The listening part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract only once. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Yes, good morning. What can I help you with today?
Doctor, I'm getting a throbbing pain in my right shoulder.
How long have you been experiencing this pain?
For the past 5 months. But the pain has worsened in the last 2 months. The pain aggravates as I'm a regular baseball player that involves throwing. Now I am also participating in basketball.
What is your age?
21.
Oh, I see. Do you take any medication?
I was taking non-steroidal anti-inflammatory drugs and muscle relaxant medications.
Are you allergic to any medicines?
No, doctor.
Have you had any surgery or any diseases?
No.
Do any of your family members have any diseases?
Yes, my mother has arthritis.
Do you drink or smoke?
No, doctor.
Well, your blood pressure is 116/68, respiratory rate 16, heart rate is 68, and weight 165 pounds. Your right shoulder shows evidence of swelling and tenderness. Radial pulses are 2/4. Bilateral. Brachial pulses are 2/4. Bilateral. Range of motion of your right shoulder shows decreased flexion, decreased extension, decreased adduction, decreased internal rotation, decreased external rotation. Left shoulder is normal. External rotation is fair. Internal rotation is poor. Rotator cuff impingement is moderate. Your X-ray report reveals presence of cuff arthropathy. You have developed rotator cuff syndrome in your right shoulder. Actually, the rotator cuff is a group of muscles and tendons surrounding the shoulder joint. A rotator cuff injury causes a dull pain in the shoulder and often worsens when you try to sleep on that side. Often, rotator cuff injuries occur in people who perform overhead motions repeatedly in their jobs or sports. Without treatment, rotator cuff injuries may result in permanent loss of motion or weakness, which may result in progressive degeneration of the shoulder joint. Although resting your shoulder is essential for the recovery, keeping the shoulder immobilized for a long duration can cause the connective tissue to become thickened and tight, a condition called frozen shoulder. I am prescribing you Vioxx 25 milligram tablet once per day. I am giving you an injection to your shoulder joint with Celestone Solispan 1.0 cc. If the condition is not improved within 15 days, then I would order an arthroscopic tendon repair in which a tiny arthroscope and tools are inserted through small incisions to reattach the torn tendon to the bone. Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mrs. Gonzalez. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. May I know your problem?
Well, when I was walking into a store yesterday, I felt dizzy and had some cold sweats, some shortness of breath, but there was no chest pain, nausea, or vomiting. I suddenly sat down and lost consciousness for a minute or so. However, there wasn't any tonic-clonic movements.
What's your age?
48.
Did you had any cyanosis, which means that the skin goes bluish?
No, doctor. Then I got up on my own, and even now I'm having mild shortness of breath upon exertion. This is totally unusual for me, doctor.
Do you have any fever or syncopal episodes?
No, doctor.
Have you had any diseases or surgery in the past?
Well, a year ago, pulmonary embolism was diagnosed. But during that time, I had an IVC filter placed due to massive gastrointestinal bleeding diverticulosis and gastric ulcers, paroxysmal atrial fibrillation, and no anticoagulation due to history of gastrointestinal bleed. Coronary artery disease status was post-bypass graft surgery at that time. I had to stay in the ICU for 3 weeks due to lower GI bleed again.
Okay. What medications are you taking now?
Aspirin, potassium, Lasix, levothyroxine, lisinopril, Pacerone, Protonix, Toprol, vitamin B, Zetia, Zyrtec.
Are you allergic to any medicines?
Yes, to sulfa.
Well, your blood pressure is 155 over 57. Pulse rate is 61. Respiration's 18, and oxygen saturation is 95% on room air. No lymph nodes or masses. No lower extremity edema. No redness or hotness. The laboratory reports show creatine 2.1 and hemoglobin 9.6. Your chest x-ray is clear. You have developed pulmonary embolism with contraindication to anticoagulation due to recurrent gastrointestinal bleed. Status post-IVC filter. You have also developed mitral valve disease, coronary artery disease, and peripheral vascular disease per cardiology. No evidence of chronic thromboembolic disease per VQ scan. We cannot rule out pulmonary hypertension. Shortness of breath upon exertion. You will need a pulmonary function test as an outpatient. I will do oxygen saturation with ambulation to prevent it causing loss of consciousness. That is the end of Part A.